Hi Dr. Ho, I'm back today again because I want to ask you some curious questions that I have or like even the community have like after doing LASIK. Yeah, so I think the very first question, right, is it normal for me to actually have like blurry vision when I actually look at the screens?
Yes, it could because you're staring at the computer screen for too long.
Okay.
That's why it's a good idea to have your interruptions.
Okay.
Every time, maybe after about 10-15 minutes of computer work,
Okay.
try to look far away in the distance for just a few seconds. You do.
Okay.
It's because when you are looking at the computer screen, looking near your focusing muscles actually have to work quite hard. And to sort of focus at a fixed distance. So by looking far away for a few seconds, every say 15 or 20 minutes, you're actually relaxing the focusing muscles of your eye.
Ah, okay. So it's like when you look at all those Excel, right, we really like focus at the number, so we are like kind of like straining that part of our eye, is it? That's why it seems like it's staring and not just looking, right? Is it something like that?
Yeah, so you have to just learn to not also to hold the computer, to place it too near to your eyes. Place it at the most comfortable distance that you can see clearly, but at the same time you're not sort of straining the focusing muscle. Because the nearer you hold your computer screen to your eyes, the more your focusing muscle, the harder your focusing muscles have to work.
What if I zoom the font to be bigger?
Not a very good solution. Because when something is, it has to be the font size has to be just comfortable.
Okay.
If it's too big, then you find that you're reading, it's
too weird.
Yeah, it's difficult to read. So. Yeah.
Okay. Then how about like, I think the second question is like, is it normal for me to have dry eyes also? Like, after staring at the screen for quite a while doing my work and things like this.
So this in a way is related to the first question.
Okay.
So you just have to learn to relax the eyes a bit more. And also it has been shown in scientific studies that when you are staring at a computer screen, you actually blink less.
Oh,
so every time you blink, you're actually giving your eyes some lubrication. So when you blink less, your eyes will tend to dry up more. And then when eyes dry up more, of course you have the kind of dry feeling in the eyes, and also the vision may start to get blurry also.
Okay, so what should I do in that situation? Like, should I, like put eye drops or like?
The eye drops is a good, it's a good solution. You can just have some lubricating drops standing by, just put a few drops whenever you feel a bit.
Okay, but will I be too reliant on it if like I keep dripping every day?
No, it's more a myth. Then of course you on your own part you make a conscious effort to blink a little bit more when you're doing computer work, and also to like what I mentioned before, that means every 15-20 minutes or so of non-stop computer work, to just look far away for a few seconds to to just relax the focusing muscle of the eye. And then of course, just remember to blink a bit more.
Okay. So then the next question is like, after doing LASIK, right, like will I be myopic again? Like, is there a chance for me to become myopic again?
Yeah, there's always that possibility, but it's actually not a very high possibility. If you, of course, don't take care of your eyes, every day you're playing a lot of computer games and so on, there can be some what we call regression. But the myopia will not come back to the way it was before unless there's something seriously wrong. If everything is done properly, your power should be stable, and even if there's a bit of regression, it will be a small regression. Well within acceptable limits.
Okay, so all these eye care habits also still need to be in place, like
yes, of course.
I cannot just like spam like hours on the screen and things like this.
Yeah, so you have to take care of your eyes, like this basic common sense stuff, things like reading habits and all that. Maintain those kind of reading habits.
Yeah, so another thing, right, is another question is like is it really true that we shouldn't be rubbing our eyes? Like like online says that like, we shouldn't be rubbing our eyes because it will affect.
But if your eyes feel itchy, no, actually it's not a good habit, because it's just when you have an itchy spot on the skin. If you keep rubbing it, you're actually making the skin more, damaging the skin, and you're going to cause the itch to get worse, because it's something like a vicious cycle. So don't just keep rubbing eyes, it's going to make it worse. But instead you can do some things that can make it like feel less itchy. Maybe you can put a cold compress on the eye, or maybe splash some cold water, or just use some lubricating drops.
If
it's very severe, you can actually see your doctor to get certain types of anti-itching eye drops, or even steroid eye drops if it's quite severe.
So even if I like that also cannot.
I know that. I mean,
like
at the side is okay,
okay.
but it should not be rubbing like hard over the whole eyeball.
Okay.
Again, studies have shown that people who are persistent eye rubbers, they tend to have higher astigmatism.
Oh, okay.
And
that cause astig.
Yes, it can cause astigmatism, and for patients who have had laser vision correction done, it can even weaken the structure of the cornea.
Oh, okay. Wow. My brother always rub his eye, so I better like stop him from rubbing his eye. Right? Okay. Then another question is like, after doing LASIK, right? Like, can I still wear color contact lens? Like, is it viable to actually wear that?
Yeah, you can wear color contact lens because most color contact lenses are the soft type of contact lenses.
Okay.
But if you want to wear those semi-rigid or gas permeable contact lenses, then that will not fit so well in the eyes. Because after the surgery, your corneal curvature is made a little bit more flat.
Okay.
So the what we call the semi-rigid contact lenses will tend to slide over the surface of the eye, so not fit very well. But soft lenses, they have a larger surface area, so those lenses can be worn after the surgery.
Okay, great. I think I have all these questions asked, and thank you so much for sharing.
Okay, my pleasure. Thank you.